The menopause is a topic most people don't talk about much, so in this video I aim to provide what advice I can to help women manage their symptoms with physical activity. Hi everyone and welcome to Exercise for Health. I'm Richard and today I'm going to provide exercise advice for women that are going through the menopause. If you're new to this channel, we offer tips, advice and exercises to help you manage your health condition with physical activity. So go ahead and tap the subscribe button below and the bell icon if you want to be notified of when we upload a new video. Firstly, let me start by saying this is not something I've had any formal training on, as it's not considered a health condition that someone would be referred to me for. However, it is something that half the world's population will experience in their lifetime, and it does affect how you feel physically, mentally, and emotionally. Now you're probably thinking, hold on Richard, you're a middle-aged man, so what do you know about the menopause? And I would answer, you're absolutely right. I have no experience of this and I'm not likely to either. However, I decided to do my own research recently, including consulting with friends, family and clients that have been through or are going through this themselves to get a better understanding of what women will experience during the menopause and how exercise may be able to help them manage their symptoms more effectively. I do think there is a huge educational gap on this topic, possibly because it isn't talked about much, but there are lots of people out there beginning to get people talking, and I akin it to mental health conditions, which only up to a few years ago was a taboo subject that people didn't know how to approach because of their lack of understanding. So although this won't be an exhaustive video that will answer all your questions, I do hope that it might shine a small light to support you while you go through this stage in your life. As you're probably aware, the menopause normally starts when you're in your 40s or 50s, although it can be earlier if you've had a hysterectomy at a younger age. It normally lasts around 7 years, but can be much longer, and the symptoms do vary from person to person, and these symptoms can also change for an individual over time. Some people don't have many of the physical symptoms, where others can really suffer from them. From the research I've done and the ladies that I've spoken to, I've created a list of typical symptoms that one might experience during this transitional period, which I'll put up on screen now if you want to pause the video to read them. But you may be experiencing different symptoms or none at all. There is also a stage called the perimenopause, which a woman will go through before her periods stop completely, and this stage can also trigger the beginning of the symptoms. Symptoms aside, the biggest eye-opener for me when talking to a close friend about what she was experiencing was how it makes you feel as a person. The effect it can have on your confidence, your self-esteem, how you perceive your body image, and how it can affect your thoughts on a daily basis, such as the feeling of loneliness or worthlessness, can all play a role in changing your behaviour. This I found very moving, but at the same time I felt it even more important to provide some exercise tips to help women manage their symptoms so they just start to feel better and maybe start to feel like themselves again. There are treatment options such as hormone replacement therapy or HRT, medications such as antidepressants to manage certain symptoms, and even homeopathic options such as evening primrose oil. However, I won't delve into this as it's not my area of expertise, but let's explore what you can do in terms of physical activity. Firstly, and most importantly, it's crucial that you do keep your body active during the menopause. Because you will experience a reduction in your body's metabolism, which will make you more prone to putting on weight, particularly around the waist and the stomach, exercise can counter this change by giving your metabolism a kick, helping you burn off more calories, not just during the activity, but for a few hours afterwards as well. In addition, exercise will help you manage your mood and stress levels due to the secretion of the hormone cortisol. It can help you manage anxiety and feelings of depression as you feel better after doing it, and it can go a long way to helping you with your quality of sleep. It can also have a positive impact on your eating habits and help you refrain from stress eating or binge eating when you feel low. The menopause can also increase the risk of osteoporosis, a condition where there is a big reduction in bone density as well as muscle mass, potentially leading to fractures. Exercise increases bone density and muscle mass, leading to a stronger and healthier body, which makes strength training particularly important. And just this week, there's been a report on the importance of strength training as we age, which I'll leave a link to in the description below. I think the key to sustaining a suitable exercise program during this stage of your life is to make sure that you don't overdo it. Exercise will be beneficial, but if it's not carried out appropriately, it can make you feel worse the day after and put you off. It may be that you can't do as much as you did in your 20s and 30s, but that's okay. Doing little bits at a time for short bouts that you know you can manage will help sustain motivation, as it will ensure you don't crash the following day. There may be days when you feel okay and can do more, but be cautious because the next day might not be as good. It's all about trying to find the right balance in terms of doing enough exercise at the right intensity to gain the benefits from it, but not doing it too hard or for too long that you end up suffering from it. Whenever you're exercising, you can use a rate of perceived exertion. This is a scale of 0 to 10 to help you monitor your intensity or how hard you're working. For most people, being around a 4, 5, 6 or 7 on this scale will be beneficial, but see how you feel the day after. For example, if you did a workout where you felt the intensity was a 6, but the next day you really suffered with excessive joint pain or fatigue, then next time work at a lower level like a 4 and see how you feel the day after. You will still feel better from doing something at a 2 or a 3 on this scale on the days where you don't feel like doing much. As I would advise for any health condition, getting the balance right will be important initially so that you can manage your activity levels in the long term and realise that some days may be easier than others. Walking is always a winner, whether it's just around the block for 5 to 10 minutes every day or going for a longer hill walk once or twice a week, because being outside in nature can bring improvements in mental well-being as well as the physical benefits. It's also low in impact and something that most people can manage without any equipment or facility. If you're not too body conscious, then try swimming or an aquafit class, as the buoyancy of the water can be very therapeutic and the natural resistance of the water can be a great way to condition the muscles without any impact to the joints. If you're a gym or exercise class person, then explore options that help you with how you're feeling. Some days may be better to do a yoga class to help you with your breathing and relaxation. Other days may need a more energetic workout that stimulates the muscles more, like using an exercise bike and some weights machines in a 20 to 30 minute circuit that's a bit more challenging but still manageable. Just be careful of doing high impact activities that involves lots of jumping, like burpees, as these can make you feel worse afterwards or the following day. However, any movement or exercise will be safe, providing you have no other health conditions, and just may need to be adapted depending on your symptoms and how you feel. If you want your own space though, and time to yourself, you may prefer to exercise in the comfort of your own home. Next week I'll be doing a home-based workout specifically designed for women going through the menopause that involves some gentle strength and conditioning exercises for the bones, joints and muscles, as well as some stretching and breathing exercises to make you feel better. So make sure you're subscribed so you can check that one out next week. Finally, don't expect instant results from the exercise you choose to do. Just view it as a way of managing your symptoms whilst improving your overall health in the long term. Start out conservatively, and if you do relapse for whatever reason and don't exercise for a period of time, don't beat yourself up about it, as this is normal and happens to all of us. If you exercise with friends who are experiencing the same stage in their life, then this might help you maintain your exercise adherence. Maintaining a positive mindset with the support from others will definitely help boost your commitment to your chosen program. So remember, exercise can be your friend if you want it to be. I would like to thank all the amazing ladies that have contributed in some way to helping me make this video, and I hope this has provided you with some help and support that you need. If it has, then please give it a like by clicking the thumbs up button below to help this channel grow so more people can benefit from it. Also, feel free to comment below on your own experiences of the menopause and if you have found something that helps you, as this might help others watching this. Thank you so much for watching, and remember to stay active, keep moving, and I'll see you next week. Thank you for watching. If you enjoyed this video today, please give it a thumbs up. You can also click here to subscribe to this channel or click here to watch a recent video. See you soon.